Afternoon. I am back here with mid-afternoon moments, and I want to talk to you about a subject that is so near and dear to me, professionally and personally, and that's mental health. Whether you guys know it or not, May is Mental Health Awareness Month. So that's why I'm taking the time to share with you real briefly about my experience professionally and personally when it comes to the world of mental health. As an addiction counselor, clients that come seek help, whether you're an inpatient, outpatient, whatever the modality is, not only do we provide substance abuse evaluations, we have people on our team that does the mental health assessment. We know that there's a high rate of mental health issues with people who abuse substances. And some of those issues runs the gamut of anxiety disorders, bipolar disorder, schizophrenia, PTSD, ADHD, and there are many mental health issues that occur when people begin to use substances. Some of it happens because people use substances. They can develop mental health issues. Some have mental health issues prior to using drugs, and they use drugs and alcohol to medicate, to numb the symptoms that come up because of their mental health issues. I am not a therapist. I am not a mental health counselor. I am a certified state board addiction counselor and a certified anger management specialist, and I do have training in other areas. But because I am an addiction professional, mental health and addictions go hand in hand. You know, a lot of people will tell you, not people, a lot of trained people, experts in the field will tell you that addiction is a form of mental health issues. Not everybody that suffers from addictions have it, but there's a large percentage that do. So I wanted to come and talk about that, so when people come into treatment, we assess for both. The goal is to treat both at the same time. I can share this with you. If you're somebody that's suffering from alcoholism or drug abuse and you're abusing it, and you also have a mental health diagnosis of one of the ones I named and other ones that you may have been diagnosed with, it is going to be extremely difficult for you to remain clean and sober if you don't treat both at the same time. One of the issues that we have in the world of addiction counseling is educating clients that if you have a mental health diagnosis, there may be a need for you to take medication. Now, I'm not the one that makes that diagnosis because I'm not qualified. I don't have those credentials. I don't have that expertise. But because I work closely with mental health staff, that you have to treat both, because what will happen is if you stop using drugs and you stop drinking, guess what's going to happen with the symptoms of anxiety? Guess what's going to happen if you have bipolar? Guess what's going to happen when it comes to mood swings, and how are you going to handle that? And what usually happens when those signs and symptoms persist, a lot of people run right back to using because they need to find a way to medicate and to feel better. Again, I am not a mental health counselor at all. My area is addiction. But I can tell you real briefly, so you can briefly kind of understand that, let's say right here at this place, this is where so-called normal people start. And this is where normal people are when they start dealing with feelings. They're here. When you have somebody who suffers from addiction, your starting line is underneath the normal starting line. So when you deal with feelings that are very uncomfortable, you are super sensitive to feelings because you're not here. You have to work extra harder to deal with feelings that come up, because that's why we use. We use to medicate feelings because of the difficulty and the lack of coping skills to deal with them like so-called normal people, if there's any such thing. Now, if you're someone who also, on top of substance abuse, have a mental health diagnosis, guess what? Your starting line is even lower. So you have a really hard time dealing with feelings like normal people. And what clients want to do when they are duly diagnosed with substance abuse and mental health issues, they want to operate up here as if they were so-called normal. And they struggle because they have to work so much harder. And at the same time, they're trying to prove to themselves they can do it without medication. And it's real difficult for them because there's this dual diagnosis, this chemical imbalance that they have. So what medication is, and let me tell you about medication. I am one of those people that if you don't need to take medication, come on, let's find a way. Let's come up with some coping skills, please. You know, let's not do the medication thing. But unfortunately, there are people out there who need to have medication. They need it because they are the ones that's going to struggle trying to deal with life issues when their starting line is not here, but here. They have all of this area right here they have to struggle with on top of what normal people struggle with that don't have those diagnoses. So they're really doing themselves a disservice, and sometimes they're able to maintain for a period of time, and a lot of times they wind up relapsing. Even, you know, even this, I'm struggling with saying this because the clients that I know that truly need it, because you see the behaviors of their mental health issues, a lot of times they don't want to take it because of stigma, because they do not want to be known as being crazy. And you'll have even family members of adolescents that I've treated in a treatment program whose parents will say, no, do not give my child medication, because they don't want to have to deal with the stigma of my child maybe having a mental health problem. But can you imagine how hard it is for that person to live life and deal with issues of life that come up, because they do come up? Having to fight all of this extra, it's challenging and it's difficult. It's really difficult. So I wanted to talk about that on a professional level. You know, when it comes to my personal life, you know, I have a family history of mental illness. I've been dealing with mental illness in my family for a very long time. So when I got into, you know, substance abuse counseling, you know, it wasn't really difficult for me to gravitate to learning, you know, a lot about mental health disorders, you know, to learn about it, not teach, not educate, not treat, because that's not my area of expertise, but it goes hand in hand. So, you know, personally, I wanted to learn not only because, you know, of my profession and I want to be the best counselor that I could be, is because I wanted to learn more about what was going on in my family. And I can tell you this, one of the things about addiction and one of the things about mental health issues is that most people are predisposed genetically to having that, which means that there is genes that is passed down from mother to child, and it's passed on in the family. So if you could look at your family, and usually if there's one person with a mental health diagnosis, and if there's one person who has an alcohol problem or drug problem, chances are they are not the only one. You know, and either people are not trained to look for signs and symptoms and just say, oh, they just crazy, you know, or people are just in denial about their alcoholism and drug abuse, and the family's in denial. You know, it keeps people sick. And they struggle, you know. That's why I'm so open about my own addiction. And in terms of me, you know, I don't have a mental health diagnosis. I'm one of the ones that don't. But I do have an addiction. So I always have to be mindful when strong feelings arise that I have to make sure I'm ready with my coping skills, because I am susceptible to relapsing back into alcohol, and eventually lead me back into drugs. And I don't ever take it for granted that I have 27 years in recovery. I don't ever take it for granted that I am a state board addiction counselor, because those things do not exempt me from the possibility of relapsing. They don't. I think that's the mistake that many people make as they're becoming clean and sober. They think because they acquire some time, a year, some people 6 months, 2 years, 5 years, they no longer have to worry about the risk of relapsing. I'm always on God, because it's an illness. So I wanted to share those things with you, about, my professional experiences with mental health issues and the clients that I serve, and personally, with mental health in my own family. And I just want to say this, it's just sad, because my culture, African Americans, we are so against medication. We are so against counseling. We are so against psychiatry. That's kind of like for the other people. I mean, we are doing ourselves such a disservice. It's a shame, because people rather have their families suffer because they don't want to worry about what would people think, the stigma. So people out there are suffering, and it's a shame. So I'm just so glad that my mother was a psychotherapist, so I grew up understanding the importance of counseling. I thank God for counseling. I thank God, and I'm a counselor, and I believe in counseling, and my children understand the importance of counseling if needed. I don't even have an issue now. If I need to go into counseling, I need some help, I have no problem doing that. I've done that throughout my years of recovery. If I need to go see a counselor, I'm going. There's no shame here. And the only shame is not getting help and sitting somewhere and suffering in silence with the illness, with the issue that can be helped. So that's why I'm coming to you and sharing this with you, because I have such a passion also for mental health issues. If you're someone that you are watching this and you feel that you suspect that you have a diagnosis of substance abuse and mental health issues, if you have some family history, feel free to inbox me. I can help with the referral for an evaluation if that's your area, because it's not mine. I do addictions. If you're somebody who's suffering from addiction, or think you have a drinking problem and don't know how to stop, please, I have a Facebook page called Another Viewpoint Counseling Services. My number's on my page. It's 770-899-0981. And please call me. I'm here to help when it comes to the area of addiction. That's my area of expertise, addiction counseling. I'm also here for those who have anger management issues. That's my area of expertise, anger management. I am certified in both areas. And like I shared the other day, I just celebrated 25 years as an addiction professional. And I have 11 years experience as a anger management counselor, and I have a lot of other trainings that I've adopted along the way, because when you deal with addiction and you move away from the drugs and alcohol, there's a whole lot of other issues underneath, and I wanted to become trained in those areas so I can better help people. So I just wanted to come with you with that. Again, any questions, please feel free to contact me. I'm here to help. If I can't help you, I know wonderful therapists. I know wonderful psychiatrists. I know wonderful mental health counselors that can help you. All right, I'll see you next time.